May first open up at school. take roll call, please. Tom Besham.
Here.
Dr. Marcia Horwitz. Here. Sandra Larson. Here. Amy Crow-Sunley. Here. Jess Smith. Here. Heinrich Schultz. Adam Hoffman. We do have a quorum, so we will proceed. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom, state your name and home address. Individual remarks are limited to 3 minutes. And if anyone is in the room that would like to speak, also please raise your hand. I don't see, anyone in the room want to speak today? And no one's on Zoom, I don't think. Is there, Samantha?
Not that I can see. There's 2 more people joining, Adam and Wayne Conacher.
Okay.
Adam, can you hear us okay on Zoom? Okay. No, I think that's everyone then.
Okay.
All right.
Next, we'll just move on to the chairman announcements and updates. I just wanted to show this document that I got off of the, well, I think it's the American Public Health Association website. And Samantha will put it up on the screen for me. But it's just the Iowa fact sheet, and the American Public Health Association encourages us all to speak out about public health when we have a chance. And so these are just some of the data points that at least the American Public Health Association feels are important about Iowa. And some of the things that you can do, of course, you can use these facts to advocate locally. You can contact your members of in Congress. You can submit a op-ed to the local newspaper, and they do publish them. So I think it's really important for us to get out there and advocate for public health. Can't find it, huh?
I can't find it, I'm sorry.
Oh, okay.
It's somewhere in here. There's
Okay.
just a lot of things minimized on
It's
this.
kind of a blue-green
Okay, I
it
remember
says
seeing it. but-
Iowa on it. But the facts that I thought were kind of important or interesting, these are good facts. Number one is Iowa has the highest high school graduation rate in the United States, with 91.4% of students graduating from high school. And this is notable, a notable measure, as there's a strong connection between education and health. People with higher levels of education are more likely to adopt healthy behaviors. So that's a good point that we have going for us. Number two, Iowa has the 3rd lowest rate of deaths due to drug injury in the nation, with 9.5 deaths per 100,000 people. Again, a good point. And then our air pollution is low. We're 25th in the nation for pollution nationally. Some of the challenges, though, that this sheet notes, it's sort of down on the last 2/3 of the page, the challenges ahead, excessive drinking. 22.5% of the adult population in Iowa reports drinking excessively, ranking the state 5th highest in the nation. So drunk Dubuque, right? So we just, I think that's something that as we start as the Board of Health, when we start our strategic planning, maybe we should think about some of these challenges. And so excessive drinking would certainly be one. Excessive alcohol use can lead to fetal damage, liver diseases, high blood pressure, cardiovascular diseases, and other major health problems. And then the second challenge that they've listed is obesity and physical inactivity. And let's see. The obesity rate has steadily increased over the decades, with 33.9% of adults in Iowa obese. Each year, an estimated $190 billion is spent on obesity-related health issues in the US, accounting for 21% of annual medical spending. So that's a big area that I think the Dubuque County Public Health Board and the Department of Health can really impact. So we'll just wanted to bring those out to think about as we do move ahead with strategic planning. I'd like to thank the VNA for the open house that they hosted. It's very interesting. I learned a lot about what they have to offer. And I appreciate that. Thank you, Stacy. And then I just wanted to give a little shout out to Adam Hoffman, our vice chair, for the article that was in April's Julian's Journal concerning the work he's doing with the U of D and water quality. So thank you, Adam. And that's all I have. Next, we'll move on to the Board of Supervisors Liaison Comments. And I see Supervisor McDonough is on the screen.
Yes, hello, everyone. Thank you. I don't really have much. I just want to do just an appreciation to you all. And I think that it's been nice as I've been on other meetings that I've seen Board of Health members on the Wellness Coalition at Food Policy Council. So I see you and I greatly appreciate that. I think it changes the interaction between the Board of Health and the other organizations that are working on public health as well. And then also just wanted to report back, you may already know this, but your comments about pending ARPA grant applications were given to the Board of Supervisors. We did approve the grant to Mercy One for $100,000 per year for 3 years. So a total of $300,000 for their Mobile One unit. And then also to the VNA, and I did my best to pass on your comments about the work the VNA is doing for some of the most vulnerable with the need for, well, there you go, power of attorney. So thank you, everyone. Look forward to today's meeting.
Thank you. Thank you. Samantha, I forgot to call the attention to the proclamation. Do you have that available?
I do.
We were able to submit a proclamation for Public Health Month, I believe it was, to the supervisors, and I attended their meeting that day, and it was proclamation for Public Health Week. And that was the week of April 4th through the 10th, and the supervisors did enter that proclamation. So the Dubuque County Board of Health and Department of Health was out where the public could see us on that day. So next, we would like to approve the agenda. Are there any additions or corrections to the agenda?
I believe we have to remove the guest presentation of the Food Policy Council, as
Thank
there
you.
will not be here. So I would make a motion to delete that from the agenda.
Thank you. Is there a second to that?
Second.
Yes, on the agenda number 7, presentation and reports. There is a guest presentation from the Dubuque County Food Policy Council, and that has been rescheduled to next month. So we've taken that off. With that, is there a motion to approve the agenda?
We need to make one more
okay.
correction. 6A, the minutes should be from March 16th instead of February 16th.
Thank you. Second, Tom?
That's what I was.
All right. All those in favor of the 2 changes that we've made to the agenda, please say aye.
Aye.
Those opposed say nay. Okay, with those changes, then we've approved the agenda. Now I'd like to move on to the approval of the minutes. Are there any additions or corrections to the minutes?
I would move for approval.
Thank you. Is there a second?
Second.
Okay, it's been moved and second that we approve the minutes as presented, the March 16th, 2022 minutes. All those in favor say aye.
Aye.
Those opposed say nay. It passes and the minutes are approved. Next, we'll move on to number 7 on the agenda, presentations and reports. First, we will have a response to public comments and questions from the previous meeting. I'm going to take the first one. We had a question last meeting about why the Board of Health decided to move their meetings to 4:30 rather than 6 o'clock or 6:30. And we did it for 3 reasons, really, primarily. Number 1 was the meetings do tend to go long. Sometimes they've been 2 to 3 hours, and that makes it quite late to be getting home at night, especially for our volunteers on the board who have full-time jobs besides this. So that was one reason. Second reason was it was more convenient for the volunteers to make sure that they could attend the meetings at 4:30 so that we would always have a quorum. And number 3, we think that it actually will be more convenient for the public. And just anecdotally, the first month that we had the meeting at 4:30, we had more visitors in our audience than since I've been on the board. So those were the reasons that we chose to move our meetings to 4:30. Were there any responses that you wanted to make?
To that one, no. The other one, the second one listed on there was the email that the Board of Health all received on April 9th, and that was asking for an update on the ARPA proposals from the Board of Health. And there was some interest in knowing about administrative costs for the COVID vaccine and the pod clinics that we had staffed at the mall and Grand River Center. And on April 12th, I just wanted to let the Board of Health know that I did respond to those questions and provided the updated information, and our board chair was CC'd in on that as well.
Thank you, Samantha. And did you get any response after you responded?
No, I haven't,
Okay, great.
not yet.
The next agenda item 7B, guest presentation. I'd like to introduce Becky Nowacek. She's going to give us some updates. And Becky, when you get to your seat, could you tell us exactly what your position is and everything? Thank you.
Good afternoon. I am Becky Nowacek. I am Region 6 Community Health Consultant with the Bureau of Public Health Performance at Iowa Department of Public Health. And one of my main roles, multiple roles, but one of my main roles is to be technical assistant to provide guidance to our local boards of health for 14 counties in the eastern part of the state. And we also help with local public health services contract, which is funding that is designated by the legislators every year to our 99 local boards of health. So we are going to talk a little bit about the changes that are taking place that start July 1, 2022. So next slide. So we are making some changes, but I wanted to give a little bit of background on what the current state is. Our current allocation across the state is $7.6 million that is designated to our local boards of health throughout the state. It is a formula-based allocation. We look at, consider population, elderly population, low income and residents for our formula that determines how much money goes to each of the 99 counties or local boards of health. Next slide. Currently in our local public health services contract, we have 19 billable activities. They range from population health activities and services such as community collaboration, so meeting and determining gaps or services that are needed in the community, all the way to direct care or home health. So we have homemakers, personal care, and skilled. As you can see here, this is the utilization of funds for home health versus all the other activities from FY17 to FY21. So right now, approximately 50% of our funds statewide are spent on home health, nursing, or homemaker care, which has been trending down historically. Next slide. So we are making some changes. Many people have asked us, why are we making these changes now after coming out of COVID? The first reason is really because of the current spotlight on public health, and it has created an opportunity to do more in our communities, really thinking about that, building our public health system. So how can we improve the system that we have? How can we build those partnerships to do public health work? And also because of how our local public health services contract is currently designed, we are missing on how things tie together to protect and improve the health of people in all communities. Next slide. So tying it all together, one of the questions we've been asking is, what should Iowans expect from all local health departments? So we are moving towards what we call some required areas of work, and then which is our population-based health, and then some optional areas of work. So the first part we're calling basic public health services. They include leadership and governance, health promotion, and strengthening public health infrastructure. And so you see there's a little bit of a description there for each of those. As we move through the next few years, we will also be including some operational skills for our public health departments. And those include continuing with their community health needs assessment and health improvement plan. But then we also are going to be developing strategic planning with our agencies, providing some assistance, technical assistance, guidance, then workforce development. And then for the last piece of it, we're going to be working with performance improvement with all of our local public health agencies as well. And the final thing is the data to inform practice. Our agencies are already familiar with this. We've done this twice. We've been collecting data from all of our local public health agencies And that report is available on our website. I'd be happy to share that link with you guys so you can see kind of the data. We're looking at number of FTEs, how much county resources are allocated to each of the public health agencies and so forth. So I'm happy to share that with you. Next slide. So focusing on population health starting July 1, we are changing the structure of our contract, how our agencies can utilize the funds, and we also are we change our administrative code, chapter 80, which will go into effect July 1st. Next slide. So our public health agencies have been very used to billing fee for service model. We have changed that and we're moving away from that. Now we're having funding being will cover salary and fringe, subcontracting, and others such as mileage, travel, conferences. And that other is anything that supports really that work that they're doing in the office. And then they'll be expected to develop a work plan to indicate the areas of work that they're going to be working on moving forward for the next year. Next slide. So the work plan areas of work, as I said, we have kind of two pockets of areas right now. The required areas of work are population health activities and services. So these are areas that local public health must work on during the fiscal year as part of our contracts. They've never had to do this before. It's always been they choose which activities they want to do and bill to us. So those requirements are the leadership and governance, health promotion, and then strengthening that local public health infrastructure. Next slide. Any questions? So yes.
You said that 50% of the money in Iowa goes to home health, and that had been trending down.
Yes.
Do you mean the need for it or the money for it?
Well, I think what happened is, when the Affordable Care Act first started, more people were being able to be put on other funders. Our funding stream is the funder of last resort for those home care pieces. So we expected that the agencies look elsewhere for fundings if they're eligible for Title 19 or anything else, then they could be put on that versus being billed to the local public health services contract. So what's not on here is initially, we're starting off that 25% of their total allocation will be spent on population health, and then they can have that 75% to bill for home care. As we move further down the years, we're going to expect more dollars to be used for population health and less dollars for the direct services.
And that's because the direct services are covered by some other.
We're asking them to look at other sources and other resources for that fund.
Because certainly with the aging population, the need for home health care is probably going to go up. Yeah. Okay.
Yes. So we're not telling them that they can't do it. We're just telling them let's look at other funding streams for those services.
Such as like insurance companies? You mean?
Insurance company, if it's Medicaid, making sure that they, if they qualify for Medicaid, making sure they're on Medicaid. We have some counties that are using some of those county tax allocations to pay for some of those services. So it just depends on where they see those funds. We have other counties that have phased out the homemaker program altogether because they only really had 6 clients on their list of people who they were serving. So it worked well for them because many of them had other providers doing those services for them and other funding streams.
And then the new way that the grants will be given, there's required work. And that's population health activities and services. But it's not going to be fee for service.
Correct.
So can you give like an example? How would it work here in our department?
Well, I think Stacy can really give a better picture on what they've been working on and how that's going to work for their agencies.
Okay.
But they're just billing their salary for staff that are working on, say, collaborative relationships. They're building those relationships in the community to continue to do the population health work or public health work. So it's just billing salary and or other to our grant versus per hour, per visit, whatever it was in the past.
Okay. And why?
So you're still providing the fee for the service. You're just doing it as a salary.
Yes.
And mileage and.
Correct. What we'd like to see is that we at some point, we're going to be able to get to the point where we can say every health department in the state of Iowa is doing this. they have the community health needs assessments, health improvement plan, they have a strategic plan, kind of like their business plan, they have a workforce development plan, so they know where they need to build off of their health or their health improvement plan. Their strategic plan can build off of that, and their workforce development then will build off their strategic plan. And then in the end, it's the performance improvement. How can we make sure that our programs, the services that we are providing, are meeting the measures or outcomes that we would like to see them at?
Are these changes part of the realignment?
This was actually started before alignment discussions started.
So could that change things too, the alignment, or?
It may change potentially where we sit in the agency, but we've had support through this with the changes. We've been very clear with our changes with legislators and also with Director Garcia, who is our interim director, and all positive responses from those that we have presented the changes to.
Okay.
What do you mean by the real?
The alignment is, I think the Department of Human Services is going to combine with the Department of Public Health at the Iowa state level. So it's kind of a big organizational change, but maybe won't have much of an effect on us on the county level.
At this point.
Okay. All right.
But still, at the end of the day, isn't the Iowa Health Organization going to measure their success by the number of people that have been reached?
What we're looking at, so our dollars are called essential public health dollars or funds. So what we want to see is how are our dollars being used to reach the whole population. Right now, we have a very small percentage of people that are actually receiving services with our funds. So by doing health promotion activities, we can get those messages out to more people within the county. So we're hoping to see that piece of it where we're able to reach more people in all of our counties throughout the state with the work that we're
But I
doing.
see as we reach more people, we're going to require more and more dollars. And, so, okay.
Any other questions?
You guys know where to reach me if you have any questions.
We won't make you say it. Yes, we know how to reach you, Becky. Thank you so much. And thank you for attending tonight.
Thank you. It's good to be back in person instead of
Thanks,
Zoom.
Becky.
So this is a grant that we've subcontracted, obviously, to the Visiting Nurse Association. I know Stacy has kind of developed a proposed plan for what to do with those funds come July 1st. And Stacy, if you wanted to go over those, I think now would be a good time. I was just going to add Supervisor McDonough put in the chat, is there a wait list for home health care? So I figured you could touch on that too.
Yes, I can. So to answer that question, yes, we always have a wait. There's not a lot of agencies that take new patients. A lot of the patients that we see for homemaking and home care aid are lower income. So this is a last resort. They don't have a lot of support in the home. Maybe have children that live outside of the area, things like that. So we do provide both the home care aid, which is the personal cares, bathing, dressings, things like that. And then we also provide homemaking. So we have been working with Becky, and Sam and I have been working together too, looking at the changes. We kind of knew these were coming over the last couple of months and been preparing for that. And so I think Sam and I went over what we thought we could propose within our grant, which is due in a couple of days. So we're still working on getting everything finalized, but the areas that we're going to be focusing on is under leadership and governance. It's investigating, diagnosing, and addressing health problems and hazards affecting the population, being accountable, transparent, and inclusive with all partners in community in all aspects of practice, and providing vaccines that prevent diseases for both adults and children. A lot of this we're already doing through the communicable disease follow-up, the vaccinations that we provide. Being accountable and transparent, that's something that we will be required to do quarterly reporting to Iowa Department of Public Health. That's a big change for us. Typically, we give our annual reports and success stories at the end of the year. So we'll be able to look at more data sets and report out more often throughout the year. Under health promotion, we'll be looking at employing the principles of risk communication, health literacy, and health education to inform the public when appropriate. Ensure public health communications and education efforts are asset-based and do not reinforce narratives that are damaging to disproportionately affected populations. work across partners and with the community to systematically and continuously develop and implement health improvement strategies and plans and evaluate and improve those plans. Develop and deploy culturally and linguistically appropriate and relevant communications and educational resources, which include working with stakeholders and influencers in the community to create effective and culturally resonant materials. So again, those are work that we're really doing a lot now, and now it's just going to become a focus within this grant, and we'll be reporting on the work that is being done in terms of health promotion throughout the community. Under strengthening local public health infrastructure, we'll be engaging community members as experts and key partners, learn from and support existing community partnerships in contributing public health expertise, use innovative technologies, data collection methods, and data sets, connect the population to needed health and social services that support the whole person, including preventative services, engage health delivery systems to assess and address gaps and barriers in accessing needed health services, including behavioral and mental health, address and remove barriers to care. So again, there's a lot that goes on within that strengthening public health infrastructure. So we'll be working on a lot of different things. And one of the things I think is newer to us is the data sets and the innovation of collecting data. We do have a lot of data that we see, but we really don't have a really good way of setting it and then bringing it out to the community. And I think that's important. And Sam and I both agree that's an area we really can focus on when looking at all of that population health. In terms of the non-population health activities, that's a direct service that we will continue to do, is providing community-based services that promote the well-being of children 0 to 5 through support to the family utilizing an evidence-based program, assessing an individual's need within their home, providing homemaking services to consumers who, due to the absence, incapacity, or limitations of the usual homemaker or caregiver, need assistance to remain in the home, provide home care aid services under the direction of nursing and or medical staff, and provide screenings, assessments, and or testing for individuals who may be at risk. So at this point, we're very lucky that we're able to still continue with some of those direct services. We still see a need in our community. I think the biggest thing, and Becky had touched on the fee-for-service changes and how we bill in the past, and Tom, you probably would remember, we would bring in rates for what our agency costs to provide the service. We'll no longer have to do that. We can just provide the service, but we do have to divide up that grant, 75% being that direct service and then 25% working on the population health. So I feel like we've got a really good start here. Sam's been incredibly helpful in looking at, the community aspect and then looking at what VNA has been historically doing and still being able to find a way to continue doing both. And as Becky mentioned, over the years, this grant will change even more, and less money and less focus of these funds will go to that direct service. And at that point, having these data sets, all this public health promotion will give us opportunities to look for additional funding sources, or to look at, is the need still there? Is that a gap we're still trying to cover? And in looking at making sure that our staff is promoting other areas, other agencies that may do these services, or connecting them with both their insurance companies and then finding the care outside of the home too. So that's kind of where we sit now. Like I mentioned, the grant is due in a couple of days. So we've been kind of working feverishly to make sure we're meeting the new needs within the public health grant, but still identifying what's best for Dubuque community and working that way.
When you say the grant is due, does that mean like you're putting in an application for a certain amount of money?
So a certain amount of money is offered for our area. We don't put in a budget. The budget's already set for that. And what we do is do the work plan, identify that yes, we will be applying for the Dubuque community. And then obviously Sam's the actual applicant. I'm the subcontract, just kind of helping with the services. But yeah, the budget's already set based on geography. Correct, Becky?
Based on that funding source that I talked about earlier, we look at the poverty. So that's all determined beforehand. This is merely a RFA, which is request for application. So it's not competitive. It goes to our boards of health, all 99 boards of health. So that amount is determined beforehand.
And do you know what that amount is already, or?
I do, and I don't have it in front of me. Do you, Becky?
Is that amount totally what we subcontract to you, or?
For that grant, yes. For the public health services, yes. And then there's also county supplemental funding that we help, which covers a lot of the things that the grant
That
won't.
would have- That would have been what we put in next year's budget.
Correct, correct.
So Dubuque's projected allocation is $204,912. And I just say projected just because the governor has not approved the budget. That hasn't come through yet. So-
Considering everything that you want to do, that doesn't sound like very much.
It doesn't go as far as we'd like it to do, but, you know, and I think a lot of it is being done. And luckily for us within our agency, a lot of our programs address public health. And so whether it's, you know, our maternal and child health programs or this one, or our I-4 immunization funding is another pot that can kind of ease up on where we're billing that time. So we try to, you know, be as efficient as we can and still make sure that we're prioritizing the biggest needs within the community.
The new data that you're collecting, is it new data or is it just information that you are now collecting? And is it related to information already in the community health needs assessment?
So I think a little bit of all,
Okay.
and we really just haven't focused on that. So it's information that we're always collecting because we report out to so many different sources. It's just something that we really haven't put a big focus on. And I think there's a good need for that. I think for the community to be able to see what we are seeing out there. And I mean, for example, communicable disease, when I give my verbal update later, I'll talk about, you know, what we've seen over the last month, but we really don't keep a strong data set that we can say, okay, this year, this is what, you know, this is where we're trending and this is what we're seeing. And I think there's just opportunities to do better in that area and be more transparent and get that information out there in a more structured way.
Thank you, that was very helpful. You could, actually, you could just stay right there and give
Okay.
your VNA monthly update if you'd like to.
Sure. So I have a lot of information here today. So for our homemaking and home care aid services, Anne had asked about a wait list. We do always have a wait list. We try to get through it as best we can. If we cannot get someone admitted right away, just due to staffing or time, or we do try and connect them with other resources that may be an opportunity for them. But we do go back every 6 months into the home, reevaluate the need, the time that's spent there, whether it's, you know, an hour on cleaning or half an hour on bathing, and make sure that that's exactly what that person still needs. And again, it's a payer of last resort. So is there other opportunities out there? So we do continue to evaluate that, but we did have 4 new referrals over the last month. And so we're excited about being able to admit in 4 new people. We also work really closely with the Dubuque Police Department. This is something that we've done over the last couple of years. And recently we went in and talked to them about the public health services we provide, whether it's through our PHS grant or some of our other programs. And then a lot of times they'll work really closely with us and refer back to our agency. And over the last 2 months, we've had 4 referrals from the officers. One was a maternal health referral with someone who really needed some additional support with a single mom and a newborn baby. We had 1 rep payee referral, which was very appropriate. We were able to get some assistance there. And 2 public health referrals where it was safety for someone in the home that we could go in and provide some of these supportive services for. So we're really proud of that collaboration, and we really see a lot of good being done out in the community with the communication we have back and forth. In terms of communicable disease, since January 1st, we've had 2 crypto cases. We've had 1 E. coli Shiga toxin case. We anticipate those will go up. Typically in the summer, we see a lot more of that. So we expect that to go up as the months go on and it gets a little warmer. We are also following 2 perinatal hepatitis B babies, making sure that they get their vaccinations and then they get the follow-up labs as well. We are treating 2 latent TB infections, and we are continuing to participate in an upcoming Marshallese TB testing event. We're partnering with the health department, Mercy, Iowa Department of Public Health, and then also Crescent, and trying to get some TB testing out to that population. In terms of our Care for Ourselves Wise Women program, that's a program that provides early intervention services to women in need for mammograms, PAPs and diagnostic testing. They had a recent change at Iowa Department of Public Health that lowered the age guideline for that program to 21, which is very exciting for us. So anyone age 21 and over that's in need of a PAP can now enroll. We're continuing to offer high priority outreach to the Marshallese population, utilizing our Marshallese Community Connector to establish relationships in translation services. And we recently signed on 2 new providers to accept our referrals, and that is Historic Bluffs and Hillcrest Family Services. Our tobacco prevention and control program, we had one tobacco diversion class taught in partnership with Dubuque Police and Dubuque County Sheriff. We have 13 youth in attendance. We continue to support a local youth group at Washington Middle School to raise awareness on health effects in tobacco. And VNA staff recently presented at local Head Start, Hillcrest, Clarity Clinic, Mary's Inn, A New Day Clinic, and then we're always encouraging quitline referrals as well. We have presentations continuing April, May, and June through our local middle schools and our youth groups on the health effects of tobacco. We also had 8 presentations with over 251 contacts throughout the community. And then we submitted our tobacco grant on March 23rd in conjunction with Sam and the health department. The notice of intent to award was posted today, and the Dubuque County Board of Health was listed as an intent to award. So we'll be completing year 2 of that program. Our maternal and child health program, we've offered one safe sleep education night that had 12 families in attendance. We've done 56 developmental screenings on children 0 to 5. We have assisted with 14 families and 6 pregnant women for presumptive eligibility applications for Medicaid. So we've been staying very busy there as well. And our oral health program, over the last month and a week, we've screened 288 children at WIC, preschool, Head Start, I Smile at School, and through our IDPH 3rd grade survey. Of the 288 screens, 17% had decay. So we did provide 167 children with fluoride varnish, and we're continuing to follow up with those that presented with decay and help them get in for preventative care. Our sealant clinics are finished and completed for the school year. We have a couple Head Start classrooms left, but then we will complete and we will start planning in for the fall. And then just in general, BNA did apply for some YAPRS funding to purchase lice treatment for children. Some of the supplies, the shampoo, conditioner, the lice shampoo, the combs, that way we can give those out. We do have nurses that will do lice checks for those in need, and we work in combination with the schools as well. And then we were also, as Supervisor McDonough had mentioned, we were recipients of some ARPA funding through the Board of Supervisors, $50,000 towards our rep pay programs. We're very excited to work with them and set a contract to give some enhanced services there.
Stacy, what was that? Your what?
Our representative payee program, and that program provides financial oversight to individuals enrolled in Social Security disability.
Yes, I remember, yeah.
Yeah. And then lastly, we did set a meeting with May Hinchett, the CEO of East Central Region, to kind of learn more about what they do and then let them learn more about what VNA does and how we can better collaborate and partner moving forward. And at the conclusion of that meeting, we did receive an ECR brain health prevention grant application from May, which we submitted. And so we're excited to see if we can find some additional collaborations there as well. So I think that's it. That's a lot.
You didn't mention, maybe Samantha's gonna mention that, but you're still giving vaccinations, I take it.
Correct. We are still doing COVID vaccinations routinely. We will continue doing those as long as the need is out there. We will, every time there's an expansion, whether or not it's a different eligibility requirement, we will move with as soon as Iowa Department of Public Health gives us the okay to go ahead and move forward.
And do people still show up?
We do. We have never, ever had a shutout. So we're so proud of that.
Yeah.
We do. The numbers kind of ebb and flow right now. They're staying pretty steady, lower than I would like to see, but we still get people, and we get people pretty much every day. Somebody will walk in almost every day for a vaccination. And as long as we have a nurse available, clinic or not, we will provide that vaccine.
And this is for the initial vaccines?
Or the boosters, yeah.
Or the boosters?
Yeah,
Are
we have
people
all
coming for
three.
their second booster? Are people?
We've had quite a few come in. That's where we've kind of seen that uptick is coming in for that second booster. So we're very glad that we're able to offer that.
And officially you have them, is it every Friday you have the clinic?
Every Friday and every 3rd Monday, and then just every day kind of as the need comes in. We see them every day, and that's fine. We would rather get those vaccines in arms. It's nicer to put them in a clinic so we don't waste as much vaccine. That's the hardest part is if we don't have that many people, then we end up wasting doses, and we hate to see that, but we don't want to miss an opportunity either. If somebody's coming in,
Exactly.
we want to give it to them.
Thank you, we appreciate that.
Our regular vaccines, we're still doing pretty routinely. We're gearing up for the fall and for back to school. And we've actually been talking with potentially looking at resurrecting our Super Shot Saturday, which was a big event we did in order to a big back to school event where we had a large number of children coming in with their school vaccines. So we're hoping that maybe something will come of that as well.
Okay, great. Thank you so much.
You bet.
Thank you.
Sandra, Supervisor McDonough has her hand raised.
Okay.
Sandra, is it okay if I ask questions of Stacy now, or would you rather I make my comments in the end as public comments?
I think go ahead right now.
And so my question is about, first of all, I don't see the VNA report as it relates to the county. I see it as it relates to the city of Dubuque. But my question is, maybe future reports can really focus on what's happening out in the county at the other school systems and VNA shot clinics and so forth. We want to be all the way to the west end. I also would say that we need to know how big the wait list is for these home health assistance. We know that we have seniors getting trapped in the middle. There are no spots in long-term care centers because of the workforce shortage. And so when we say there's a waiting list, I think we want to maybe dig into that. How long, how far, who, what's the hope? Do people just give up? And so maybe there's a role for county health to play in that. And then my third comment certainly could be for future, but I think we have a real disconnect in where women give birth when they're on Medicaid. Medicaid is not accepted by all of our providers, and Crescent Health Center does not deliver babies. They will do prenatal care, but they don't deliver babies. And that's something that I think women, like the Guatemalan population, drive to Iowa City when they're in labor. So we want to probably, the VNA would be our vehicle to know these pieces of information. Those are concerns I have in follow up to Stacy's report.
Thank you. Where do the Medicaid ladies have their babies?
So it depends on which type of insurance they have. And so we do work with both hospitals and trying to, but Anna's right, there's not a lot. They have to travel out of town too. So I can definitely get some more information and share that at the next meeting.
Yeah.
So the medical associates, physicians don't take care of public aid insured?
It depends on the insurance. So between Iowa Total Care, it depends on which insurance you have is where you can go, but there is a problem with getting that care.
All right, well, thank you, Stacy. Our next item will be an update, I believe, from Samantha, Dubuque County Health Monthly Update and COVID-19 Update.
Okay, hi, everyone. Yeah, I'll start with our just general department monthly update because Stacy said a few things that reminded me I had to write them down. So I'll share them before I lose them. Since the last time we met for our Grants to County program, we've tested 53 private wells in Dubuque County, which is a big increase compared to the last time we met. I think I reported 20. So that's exciting, warmer weather. We get a lot more calls, and you may have also seen our ad in the TH and around town, getting people to call us and sign up. So that's going really well. Bailey has also been working with the Iowa DNR on their infrastructure fund, which provides financial assistance for failing septics in Dubuque County. And those funds come from American Rescue Plan Act. So she's successfully helped 18 residents in the county apply for those funds that will pay for full service to get a brand new septic system put in, which is exciting.
Were they approved or they've just applied so far? Or?
As far as I know, they've all been approved and allocated for. We just haven't received the funds.
Great.
And then Bailey and I will also be at Party for the Planet this Saturday from 10 to 3 at the River Museum to promote our water testing and just talk about general environmental health in Dubuque County and how that relates to mental health. So if you're interested in coming, stop by. And this morning we also had our Dubuque County Public Health Emergency Preparedness Coalition meeting, which went really well. Good attendance from lots of the players that have been involved with our COVID response. And we're preparing for a drill with that same group that will take place on May 26th. So those are in the works. Like Stacy mentioned, we're now working with the Iowa Department of Public Health, Mercy, and the Visiting Nurse Association and Crescent to provide increased TB testing to the Marshallese community members in Dubuque County. And so right now we're looking at attending their Constitutional Days event at the end of May to provide some education there and testing opportunities using the Mercy Mobile One unit and some VNA resources. And my last one on here was I really wanted to give a shout out to Stacy and the VNA, because on top of all the things that she listed they're doing, they're also taking the lead on applying for all the grants that we subcontract with them for. And I know that's a ton of work. So, and I greatly appreciate it. So just wanted to make that aware, you all aware that she's been applying for all those grants on our behalf, which has been a huge help to us too.
I was wondering if you had any report on, I think you went to some conference or something,
Forgot
some
about that too.
education.
Oh my gosh,
Yeah.
so much has happened since I last saw you. I also went to Atlanta for an emergency preparedness public health conference. It was their first one that they've held since the pandemic started in 2020, and that was really good. It was focused on state and local health departments and how they responded to the pandemic. There were lots of listening sessions for us to talk about what went well, what we would change for the future, and some very important people from the CDC there to listen and take note, so that maybe when this happens again or when there's another emergency event that involves public health, things maybe go a little bit differently for us on a local level and as a state. And I got to just network with people from all over the country in the public health world. So I really appreciated being able to go. Me and one other representative from our region were funded to go through our regional emergency preparedness funds.
Good.
Sam, you talked about the drill on the 26th. There was a emergency drill yesterday. Does the did you guys participate in that at all, or?
No, we did
No.
not participate. I think that one was more focused on emergency responders.
Okay.
EMS and fire police, so we did not participate in that one. This drill that we're planning is also going to be funded through those regional emergency preparedness funds. Every county in our region has kind of opted in to have this hosted in their county. So it's put on by the state, but every county is doing it in our area. Okay, then I will just give you a quick COVID update. Dubuque County is still at a low community level according to the CDC. And just a reminder of those three metrics that are used to determine our low level. It's new COVID-19 admissions per 100,000 in the last 7 days, the percent of staffed inpatient beds occupied by COVID patients, and the new total COVID cases per 100,000 population in the last 7 days. So as you can see from that map, we're looking pretty similar to other counties in the state, and the US as a whole is looking pretty green, which is exciting. This is just a reminder. This was a slide last month also, but these are some mitigation recommendations from the CDC when we are at a low level. They mostly focus on staying up to date with our vaccines and our boosters and maintaining improved ventilation in indoor spaces when it's possible. And then continuing to follow the CDC recommendations for isolation and quarantine, which haven't changed since we last met either. And then really making a plan for needing to get tested or needing those antivirals or antibodies if needed. If you are in that situation, make a plan for that now. Although we are at a low community level, our cases in Dubuque County are slightly increasing. We had 41 new cases in the last 7 days in Dubuque County, which is just under double from what it was last Wednesday when we collected that number. Well, yeah, on April 14th, we were at 24. That was the number, sorry. Our hospitalizations have stayed the same for the last few weeks. We're at 2, but the incident management team continues to meet with hospitals on a weekly basis just to stay and check with each other and have that transparency and open communication about our situation in Dubuque County. But there have been no new COVID-19 related deaths since we last met. Our total count for that is 294 in Dubuque County.
Do we know what variant people are having?
Yep, I have that slide coming up.
Okay.
1 second.
Great.
So this is our positive cases by age group since we last met also. And you can see that the majority of those are age 55 to 59 or 60 to 64. So more older adults. But overall, our highest percentage of positive cases are typically among those 19 to 24. For our across the whole pandemic, the 2 years, they're at 12% of all of our positive cases, followed by children age 0 to 10 who are at 9%. So this past month does look slightly different than what our situation looks like as a whole. This is the slide Amy was asking for. These are our variants by month in Dubuque County. And I believe it was this morning we finally got the data for April. And as of right now, the Iowa Department of Public Health is reporting 100% of all of our positive cases so far this month are Omicron. And just a reminder, that comes from sequencing. So it's not every single test that they're getting. It's just a randomized sequencing that they perform at the state hygienic lab. And then for Iowa as a state, we're pretty similar to what that we're seeing as a whole. They're reporting 99.1% of all positive cases being sequenced in the state of Iowa are Omicron for the month of April, and the 0.9% are marked as other. This is a vaccination overview. As of today, 70.58% of our county's 5 and older population have either completed their vaccination series or in the process, meaning they have at least their initial dose of a Pfizer or Moderna vaccine or their single J&J vaccination. 97.6% of the county's 65 and older population has either completed their vaccination series or is currently in the process also. And then 57% of our residents 12 and older who are fully vaccinated now have a booster dose too. And we do not have any data on second booster dose through IDPH yet, at least.
Do you think are they maintaining that data, do you think, or?
We have not heard from at least I did not recall hearing from the Iowa Department of Public Health if they have that data or if we'll get that data. It's just not available to us yet, but when it does become available, I will let you know.
Okay.
I would think they would be able to run it from the vaccination collection.
Yeah, I would think so. This table here, Mary Rose had gotten on April 11th, and it shows a breakdown of our vaccinations by age group. And I found it pretty interesting. Overall, the younger you go, the less vaccinated we are in Dubuque County. And that does align a little bit with what we see overall in our positive cases by age group too. But our Dubuque County and our City of Dubuque websites have local vaccination information on them, and those are kept up to date. And on there, they also include the information on the VNA walk-in clinics, which are, like Stacy said, the third Monday of every month and on Fridays. And then we're still staffing our Sleeves Up phone line and the VNA phone line. And to date, since we started that with the VNA, and I can't remember off the top of my head, it was in January that we started. I just don't know the exact date, but the VNA has received 240 calls on that phone line from community members. This is just some general COVID testing information. The incident management team has been talking about this more frequently, and we've decided or determined that what we think makes the most sense is after receiving a positive COVID test or even after receiving a negative rapid test result, but still experiencing COVID symptoms, it doesn't hurt to get that confirmed with a PCR test for multiple reasons. PCR tests have a wider range of detection, so they may be able to pick up on things that a rapid test cannot pick up on or isn't picking up on when you take that test. And then also those at-home PCR tests that we have at the VNA and at this county health department do get reported to the state and are included in these data numbers. So just wanted to reiterate that. And then I've listed a few testing opportunities in Dubuque County. Like I said, we still have those free PCR at-home test kits here and at the VNA, but if you go to testiowa.com, you can get a full list of where they're available in the county. And then Hy-Vee Pharmacy is still doing free in-person PCR testing. And the federal program at covidtests.gov still offers the for at-home rapid test kits, and I believe now you can go through and order for a second time too. And then Epic Health and Wellness still offers their rapid testing, it's just at a cost.
Do you have any idea, those federal tests that were sent to us for free? What is the failure rate on that? I mean, how big of a percentage are not good results? I mean,
I have not heard a specific percentage, especially for those tests in general. Have you heard that at all, Stacy? I can look into it though.
because I mean, that's what we have, and I'm just wondering if they could be relied upon. And then, have you heard anything about the availability of antiviral medications?
Yeah, I did include a slide on that. It's not this one, but I think the next one.
Okay.
This was from the CDC. I just thought it was a really good infographic promoting when to get tested if you're symptomatic versus asymptomatic. And then also showing the increase in those at-home or over-the-counter test kits. And so again, just using this to reiterate, if you do take one of those tests, it doesn't hurt to do a follow-up with a PCR test. Yeah, this slide. So there are antibodies and antivirals available in Dubuque County. I included 2 links here, Test to Treat, which if you go there and type in your zip code, it'll show you exactly where those are available in your area. And then this second link is an overview of the treatment options that have been researched in the United States for COVID-19. But what the incident management team wants the public to know is that in Iowa, or at least in Dubuque County specifically, you cannot just go to these locations and request the antibodies or the antivirals. You need a prescription to do that. So consult a healthcare provider first, along with having that positive test so that you can get a prescription to go to one of those providers, which I believe are Mercy One and Hardig Drug.
So if you go to one of those places and have a positive test, then you'd still have to contact your own doctor or something like that?
That's my understanding, yeah. Yeah.
The earlier you start these meds, the better. And so there's always, there's an urgency to getting tested quickly and then contacting your medical provider quickly.
And the medications aren't without side effects or interactions. So it's really important that, you are evaluated, I guess, by a provider to make sure that, you're not causing further damage or increased reactions.
Mm-hmm. That was all for my update though, unless there's other questions.
Thank you, we appreciate that.
Yeah.
The next item on the agenda will be the Board of Health member topics of interest, and tonight Jessica Smith is going to give us a presentation.
So I wanted to talk tonight about a new initiative from the Iowa Department of Public Health related to Narcan and naloxone access. So I'm not sure if you're aware, but currently citizens are able to obtain Narcan kits from pharmacies. There's also the Harm Reduction Coalition that will provide Narcan kits to the general public free upon request. And then there's a program where IDPH will provide Narcan to first responders, police, fire, those types of people who would need it to respond to an emergency. Recently, there's been a new initiative regarding increasing access at other local community businesses, specifically restaurants, bars, libraries, convenience stores, gas stations. We know that quick access to Narcan is really life-saving and really important. The way Narcan works is that it kicks kind of the opioids off the receptor and allows general normal respirations to restart and continue. So we know that a timely response to an opioid overdose is really, really important. In 2021, Iowa saw an increase in the number of opioid-related deaths. And more recently, we've seen that 2/3 of all opioid-related deaths are really related to kind of this increase in synthetic opioids, so fentanyl. And a lot of what we're seeing is that drug producers or manufacturers are using fentanyl, which is cheaper and actually stronger, to cut into other drugs. And so when a user is purchasing or using, they may be using something that's stronger than they really believed it to be. So IDPH is providing up to 5 kits to any restaurant, bar, community business, library who's interested in it. The organization needs to kind of attest that they have undergone training, which is provided by IDPH. They are allowed 5 kits. They need to attest that the kits will remain within the business or organization and only be used for people, you know, in need. They won't be sold or given away for, I guess, personal use. But I just wanted to bring this program to the attention of the board, discuss if there are any organizations or, you know, I guess service providers in the county that we think could benefit from such a program. Is it something that the Chamber of Commerce could, you know, should discuss, or something that we should promote kind of amongst local businesses in the county?
Do you have any idea what training the restaurant or bar person would need to have?
It's actually pretty, I think it's pretty minimal. I don't know specifically the training, but as a pharmacist, I provide training to individual patients, and it's very, I mean, it's, you know, 5 to 10 minutes. It's not very in-depth. The kits are very easy to use. They're just a nose spray. So I don't think it's extremely in-depth or lengthy training, but I can certainly look into that.
Okay, great. Well, I certainly would like to have every bar and restaurant have this in Dubuque County.
So I didn't know if there were recommendations on what we would, or how we would promote that, or I was just kind of bringing it here for ideas, I guess.
Right.
What kind of liabilities are there?
So that's a great question. From a medical perspective, there's very few side effects to giving Narcan to a patient who is not experiencing an overdose. So if there's not opioids in the body and Narcan is given, there's little risk, I would say. I guess I'm not sure.
But we have the Good Samaritan law,
That's very true.
you
Yeah,
know, so there's that.
Yeah.
that's very true. Yeah.
'Cause I know in the past, we've tried to get it into places like
Okay.
libraries and
And what happened? Unsuccessful, just.
I don't think it went very far. I can't remember that it got a lot of traction.
Really?
Yeah.
Is it a problem? Is it a problem we have in our county? I mean, do we have opioid accidental deaths?
I absolutely think we do.
Yeah.
Right?
Yeah.
And fentanyl,
Fentanyl.
Yeah.
but the jail has one. There's,
Mhm,
yep,
mhm.
so, I mean, I'd like to see one at the county courthouse if there isn't one there.
I don't know if there's one there.
Yeah. Well, is it something that the board is interested in looking into, trying to maybe make a concerted effort to get these kits out, or at least get the information out to places so they know where to go for the kits, where to go for the education? And
Can we put something on the website?
Yeah, we can always put that on the website.
could maybe put some sort of link. I'm thinking almost like a letter to the Chamber of Commerce and
Mhm.
I don't know, maybe the Rotary Club and some of these other places that really have an outreach, so.
Well, and this could be an op-ed that you could write,
Correct.
Jess, like
Oh,
like
sure.
what you were talking
Yeah,
about, Sandra.
true, that's a good idea.
I just volunteered.
Thanks.
One of the questions I'd have, and I see that Ann McDonough has raised her hand, but in the past, we've just had some recent discussion about funding for opioid treatment. And I just wonder how this fits in that whole scheme. I mean, I'm supportive of it.
Sure.
But, you know, are there other entities that are charged with this? Since they've taken on some of the funding as opposed to the health group.
I guess maybe the Iowa Department of Public Health thinks that it won't cost a lot because they're providing the kits, they're providing the education. I think it's just, and I don't know if this would be costly to send out a few letters to some organizations or offer to speak at organizations, you know, just to get the word out. I'm not thinking that it would cost a lot, But you're absolutely right. We do always have to be cognizant of, especially mental health dollars, because they come from a different place. So,
Well, it needs to be substance abuse dollars.
yeah, substance.
So it's a totally different.
Different than mental health. Correct. Thank
Yep.
you. Should we take that question?
Maybe it would shed some light on what we're discussing.
Yeah. Supervisor McDonough, do you have a question or comment?
Well, I think I can give a little bit of direction. So before COVID, there was a subcommittee of this Board of Health, and they were looking at Narcan to be distributed widely. At that time, they had to have locked cases. So do you remember that, Tom, where we had to get some kind of locked case because you couldn't have this in a school and have, 12-year-olds decide that they're going to look at Narcan, right? So that kind of stalled it, that there was some procedural steps. It's never been the cost so much as it's been about the how to. I actually, immediately after this meeting, I'm going to attend the first Dubuque harm reduction meeting. They haven't met for forever. Jess, I don't know if you're involved in that or if that's a different group. Yeah, and so I'm going to listen there and I can pass on this information to them. Last point, starting July 1st, Dr. Ann Cameron Williams, who works in she's our disabilities director. Part of her salary is going to be paid by the county to do substance abuse work. So we will have someone who's going to learn the workings, and so we'll have some expert assistance. I think it's a full quarter of her time will be to start doing this work. And I know Amy, she's hoping to work with you as well to kind of get caught up on, what work you've done with DASAC in the past. So we recognize, I think, as supervisors that there's some more work to do here. And the Board of Health can't do it all as you search for top level executive help. So, but yeah, it really is it's a real problem in our county. And, I appreciate that it's at the jail, but people in the jail are about as safe as anybody from, opioids. It's when they leave that they're very likely to overdose because their chemistry in their body has reset due to forced, time away from the drug. So it's a topical issue. I appreciate, what we're talking about here. And I don't know if anybody wants to, join in. It's a Zoom meeting immediately after. It starts at 7:00 tonight. This group hasn't met in forever.
What's the organization called?
It's called Dubuque Harm Reduction, but they may have been, I don't think it's through Mercy. My suspicion is it's a group of citizens who call themselves Dubuque Harm Reduction. They might be doing like the Safe Needle Exchange program, things that, yeah, Jess knows, things that are not always with authority. They're just getting the work done. So I'm happy to explore and make outside connections with people who might be interested in it.
Thank you, Supervisor. I have a meeting scheduled next week with Ann Cameron Williams, so I will mention this program to her and see what her plans are, and then maybe bring it back next month to see if there's something we can help with.
Okay.
Yeah, I like the idea
Okay.
of moving it forward, but
Yeah.
moving it forward so we're not stepping on each other's toes.
Absolutely, absolutely.
Can Narcan, it can't be abused, or can it?
No, all it does really is kicks the opioid agent off of the receptors.
Okay.
And it has a relatively short kind of half-life, and so no, there's not really risk for abuse.
So maybe it doesn't have to be locked up anymore. I don't know.
And when I was looking through all these documents, it said you have to have proper storage conditions, but not specifically a locked cabinet, so.
Thank you very much for the report, and thank you for
Gotcha.
looking into that, Jess.
Yes.
The next item on the agenda is number 8A, clerk for position posting. Samantha worked on updating the job description for the clerk position. So I hope everyone's had a chance to look at that. I think the only real changes have to do with the clerk would assist with some of the water testing. And I don't think that was in the old job description. And this job is going to be posted pretty soon, I think. Do you know?
Yeah, ideally, this would be approved tonight by the Board of Health to go to the Board of Supervisors for their Monday meeting and then be posted next week after that.
Okay.
And this is to make that a full-time position because that was approved by the Board of Supervisors a few months ago. Currently, our office clerk is part-time.
So do we need to make a motion to accept this?
Yes.
I'll make that motion to accept the clerk for health department job description.
Thank you. Is there a second?
I will second.
There's been a motion and a second to approve the new job description for clerk for health department. Is there any discussion? Hearing none, let's take a vote. All those in favor of this job description, please say aye.
Aye.
All those opposed, say nay. Motion passes. So that will be submitted to the supervisors.
Yep.
Thank you. Next item 8B. This is just a receive and file. This is the Food Policy Council grantees Q2 report. And I'll hang on to these for next month because I did, when I was looking at them, I had a couple of questions
Oh, sure.
for Ms. Sanger. So when she comes next month, we can ask her some questions. But do we need a motion to receive and file? Yeah.
I'll make a motion to receive and file.
All right, second.
Second.
It's been moved and seconded that we receive and file the Food Policy Council grantees Q2 reports. All in favor, say aye.
Aye. Discussion.
Oops, discussion, I'm sorry.
All right.
I skipped right
I
by
made
that.
the motion so we could have
Yes.
a discussion. So,
Yes.
I guess I'm wondering, I'm not quite sure if this is something that the Food Policy Council should be receiving and filing, or should it come all the way through to the Board of Health?
As of right now, both entities receive and file. So this will be on the agenda for the next Food Policy Council meeting.
Okay.
And so it could go either way, whichever the board wants, but both
Well,
are.
if
seen.
it's gonna be on both, I would think the Food Policy Council would receive and file it prior to us.
Yeah, okay.
They're pushing it through to us, right?
Right.
So they should receive and file it first.
I thought they issued it, so. I mean, don't they issued this report, the Food Policy Council.
The grantees are the ones who send them in, and we're the
Okay.
ones who provide those funding. The funding for that. So it kind of goes through both of us a little
Okay,
bit differently.
Because the relationship between the Food Policy Council and the Board of Health, it's an unusual relationship, sort of. So we'll just have to kind of work our way through this as we go. We're not really in charge of them, but we're in charge of their funds. So,
This is the last year, though, that you'll be receiving reports like this, and we'll be providing grant funds in this way. It'll move to a pay for service type of program run through the Board of
Okay.
Supervisors starting July 1st. So it'll look a lot different, and we won't be receiving and filing these types of grant reports like we've been calling them.
Okay,
okay,
that answers my question.
thank you. Any further discussion on this? Then let's take a vote. All those in favor of receiving and filing the Food Policy Council grantees Q2 reports, say aye.
Aye.
Those opposed, say nay. Okay, the motion passes. We have received and filed. Unfinished business, that's number 9A on the agenda, the Executive Director position updates. Okay, so the position is listed, it's posted on GovHR, so you can look it up. And it's been there since last week, I believe, so we're on the way. And then I've put up here the timeline that has been provided to us from GovHR, who is our executive search team. And you can kind of see that for the week of this week, basically, we should be getting a final copy of the brochure that I believe then goes out to the applicants once they have applied. There is a May 13th is the deadline for applications. And so you can just take a look at this. We're going to try and stick to this timeline just as closely as possible so that we can get the position filled with a dynamic leader. We do have a meeting. We have a bi-weekly meeting set up with the recruiter. And I think that'll be on Tuesday that we'll be meeting with her just to get her update, and then we can share that with the rest of the board members. One thing I wanted to mention was that part of the interviewing process will be a panel of our stakeholders and our community partners. And we'd like to get that list of people that we would like to invite to do that finalized so that it can be presented to Dawn Sherman next week, I'm hoping. And so if any of the board members have someone that they'd like to suggest to be on that panel, please contact Samantha. We have, the regular people. We already kind of know Stacy from VNA. We'll be inviting Becky from the region. People from I think representatives from the hospitals, representatives from the schools, City of Dubuque Health Department,
Board of Supervisors.
Board of Supervisors. And then there might be somebody else in the community that you think would be important to be on this panel interview. So just let us know. We'd like to get that all compiled so that when it's time to send out those invitations, we're ready to go. So, that's all I have. Any questions about the director search so far? No, thank you. All right, moving on then. Well and septic updates and the permitting process.
Bailey's on too. She should be able to unmute, and she was just going to share an update to the board.
Okay.
Hi, this is Bailey.
Hi, Bailey.
Hi. So we've had the new septic permit reviewed by many people, the county attorney, a few of the Board of Health members, Corey Frank, environmental specialist senior from the Iowa DNR, the City of Dubuque, and many contractors, and received great feedback. And I mean, we believe that we've made all the necessary changes to get the permit approved and bring it into effect. So that's.
It looks really good. Do you know whether it has been submitted to our county auditor? Has it?
Yes, we did submit it to him. I think twice, before and after our last meeting as a Board of Health.
Okay.
But we have not heard back.
Okay. And this very closely follows the state ordinance or statute that's in place right now. So I
Yes,
think it's going to help the contractors a lot, so they know exactly what we expect of them.
absolutely.
At our contractor meeting, I think that was last month, this was shared with them too, and everyone's on board and excited about the new process.
Great. Do we need to have a motion to accept this or?
Yeah.
Yeah, we tabled the last one. So.
Yeah.
So I would make a motion to approve.
Second?
Second.
It's been moved and seconded that we approve the on-site wastewater treatment and private sewage disposal system homeowner and contractor rules and regulations policy. Any discussion?
This is Adam.
Professional.
Yes, Adam.
Yeah, I have just a couple quick things. So first, Bailey and Sam did an awesome job at the contractor meetings, and I was in there and they did a wonderful job getting feedback and providing information and providing Corey Frank. So that was just fantastic. So I just want to, shout out to both of those two, thanking them for that. I thought that was really useful. And I think the document is fantastic. There's one little item I have under the note, the third bullet point, just that last sentence after it says we won't issue a permit, but then it says a soil test might be okay. So that for me is just like a little ambiguous there. That was the only part that I thought could just be slightly cleaned up.
Let me share my screen just so I can make sure we're talking about the same thing. This one here, Adam.
Yeah, just if the soil analysis is conducted, that may suffice. And then the sentence before just says we will not issue a permit until one of those two, but then it just says if a soil.
What would be your recommendation?
Okay.
I don't know. That's why. That's a really good question. Yeah, but I don't know. It just says like, it's not gonna, you have to do these two things, but it says maybe a soil thing might work. I don't know.
So until one of the two is completed, a perk test or a
Yep.
soil analysis. So yeah, that has to be added in there.
What, Bailey?
A percolation test or a soil analysis, depending. So for a soil absorption
Oh, yeah,
system,
that's perfect there, Bailey, or Sam,
Yeah.
pardon me. Yeah.
yeah, for a soil absorption system, a percolation test is required. But for a sand filter, either a recommendation letter from an engineer, a soil engineer, or a soil analysis will work. Either of the two.
So are we saying that a recommendation letter may not be required? For the second bullet, it's a recommendation letter or a soil analysis?
Yeah, either or, a recommendation letter or a soil analysis, whichever one they want to get. But they have to get one of the two.
So if a soil analysis is conducted, if we take that out of there and just put a recommendation letter or a soil analysis is required.
Right.
Yeah, the three is.
For a sand filter or any alternative system.
One of the two, either a recommendation letter or a soil analysis is required.
Yeah.
Yeah.
That's more clear that way.
So Adam, can you see how it's written now?
Yes, I can. Yep, just fine.
What do you think about it?
Yeah, I think that's fine. Yep.
Okay.
Thank you, Adam. That helps.
Well, thank you guys. Yep.
Thank you.
Any further discussion? Okay, hearing none, then let's go ahead and vote. I think we already have a motion and a second.
We have a motion. We need a motion. Do we need a motion to accept the amendment?
Yeah.
Oh,
I would motion to accept this current amendment.
okay. Is there a second to that?
I'll
Okay,
still second.
all right. So now, and that's a friendly amendment. So now we have a motion to accept the document as amended. All those in favor say aye.
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 All those opposed, nay. The motion passes, and this on-site wastewater treatment and private sewage disposal system homeowner and contractor rules and regulations policy is adopted.
Surely there's an acronym.
Right. Does that go any further now? Does that-
No, I think that's all.
Okay,
That's
okay.
gonna help a lot. Thank you.
Okay.
Thank you.
Thank you, Bailey. Let's see, we're on number 9C, ordinance updates. And we are making progress with the ordinance updates. We have a meeting scheduled with the county auditor, Kevin Dragato, tomorrow. And I really think that's going to move us forward so that we can get these updated. And we'll report back to you next month. Samantha and I are going to meet with Mr. Dragato tomorrow. All right, next, new business. Does anyone have any new business they'd like to bring forward? We have none listed, so. Next will be board communications and reports. And this is your chance as a Board of Health member to talk a little bit. And especially, you can talk about anything, but especially give us a report on any of the different organizations that you may have attended, such as the Wellness Coalition, that type of thing. Does anybody have anything they'd like to report today?
Well, I attended the recent Wellness Coalition meeting, which was last week, I believe, and there was a lot of conversation about how to promote wellness in the community, and a big point and item of discussion was the community, the Healthy Hometown initiative, and gentleman Aaron Swanson from Wellmark, I believe, was giving a presentation on this, on how to promote wellness in the community. And there's a steering committee that has been started to implement this and to just involve the entire community on multiple health improvement matters. So
Great.
Samantha was there.
Thank you. Thank you, Dr. Horowitz.
And I've been attending the DASAC, Dubuque Area Substance Abuse Coalition meetings. I feel really old going to those meetings because I was on this committee back in the early 2000s, and nobody else was, they didn't even know it existed back then. They thought it was old in 2014, and I'm like, no, it's no. So anyway, long story short, they're going back and trying to find some of the bylaws, and I offered to be on the bylaw committee to help write or rewrite those bylaws. But we certainly don't need to start from fresh because there has to be some old ones in a file somewhere. And the next meeting is coming up pretty soon. So nothing to report really on that, but they have been talking about the Narcan on that too. So I think they're distributing to different places too. You might want to talk to, oh, what's his name from Sassy? Cameron or Corey or, I know who you're talking about. Okay, the prevention specialist supervisor.
Thank you. I attended the Food Policy Council meeting, and one takeaway I have is that they need a grower to be on their council, somebody who actually grows fruits and vegetables, I believe. So if anybody knows of a county grower, let us know, because they'd love to have them on the Food Policy Council. Let's see. Any other reports? Thank you all. And our next meeting will be on May 18th, 2022. That's Wednesday, and it will be at 4:30. We'll have a Zoom option, but we will be live. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please raise your hand if you're on Zoom, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. If you're on Zoom, you can raise your hand. If you're in the room, you can raise your hand. Yes.
Can I just ask when the next food council meeting is that you said you just attended?
Sure. Would you please state your name and the street that you live at? You do not have to give the number, so.
Kathy Wymisker. And my address is 6
Street.
Oh, Weber Road.
Okay, thank you. The next food policy meeting, I think Samantha's looking it up right now.
Yep, sorry, give me 1 second.
I think
It's
Ann-
May 9th,
Okay,
May 9th.
thank you.
And I think that's at 4:30 or something like that.
They're at 4:30.
Four.
And they're in this room also.
Thank you.
I think it's 4 o'clock. But it should be on the county calendar. It will show up soon on the county website on the calendar.
Okay,
It
thank
is
you.
4 o'clock, sorry.
All right. If there are no other public comments, is there?
That's her hand.
Who?
Ann.
Hello, yes. Go ahead, Supervisor.
Sorry.
McDonough.
Thank
That's all
you,
right.
thank you. Ann McDonough, 2469 Whitetail, Asbury. I just would ask again, this board to have some discussion about the maternal health issues. If the board, I think the board needs to decide perhaps if this is something the board wants to address or not. There's a very few slots. My understanding, there are very few slots for Medicaid for folks who have no insurance other than Iowa Medicaid. And there's very few people who are through the Mercy maternity clinic, right? I think, I don't know, maybe a half a dozen, maybe a dozen, maybe 18. But Medical Associates does not accept Medicaid patients for this. That's my understanding. So that's why we have women and unfortunately women of color and minority status who are being directed to the University of Iowa. And the question is, are they in labor? certainly they can't be very active labor, a lot of things that get raised there, but all the same, is that something that the Board of Health wants to talk about? I know it's a need. I just don't know who to ask to look into it. So Crescent Health does not deliver babies. They can do maternal health, but we just don't have that as it appears to be a gap in our system. And clearly it's hard to recruit people and keep people here if the answer to a poor woman is to go to Iowa City to give birth. That's just a tough one. So thank you for your attention to that, should you choose to take it up.
Thank you. I think there is interest on the board, and we'll certainly list that on our next agenda so that we can discuss it. Thank you, Supervisor.
Sandra, I think.
Yes,
Just a comment on that, I can also invite Vicki Gaspin, who is our maternal and child health coordinator here in Dubuque County. So works with Iowa Department of Public Health and our maternal health to maybe come to the next meeting if it's on the agenda. And she can talk about what she's seeing and some of the
that'd be
stats.
great. Yeah,
And it'll give us a little bit more insight.
Yeah.
She's certainly got more knowledge than I do in that.
yeah, okay. Thank you very much. Are there any other public comments? Seeing none, I would like a motion to adjourn.
Before we make that motion, can we also get an update on the doula program too?
Oh, yes, she'll do quite a bit on the doula,
Great.
so.
Okay,
Okay, sorry, Tom, go ahead.
I move we adjourn.
Second.
it's been moved and seconded. Is there any discussion? Hearing no discussion, we'll take a vote. All those in favor of adjourning the meeting, say aye.
Aye.
Those opposed? Okay, we're adjourned.
Thank you, everyone. Great meeting. Thank you.
6:01 p.m.